Right. Good evening. This is Dr. Kirankumar Reddy, consultant pulmonologist, KIMS Hospital, Kondapur. Today, as we are celebrating World Asthma Day, this year's Asthma Day theme is Knowledge Empowers. So, today I am here to create awareness about asthma. Mainly, what we have to remember is we cannot cure the asthma, but we can control the asthma. So if we are having asthma, we need not to compromise in daily activities or sports or in work. But for that we have to control asthma strictly. But we can't cure it completely. That we have to remember. So people, those who are having asthma since long time, they will have usually tight chest, cough, and wheezing, and nighttime sleep disturbances and all will be there. Usually in asthma, will be like in airways, there will be inflammation, means kind of swelling and overproduction of mucus secretion will be there. That will cause narrowing of the airways. That will lead to chest tightness and air won't enter properly into your lungs, and exhalation process also won't happen properly, so that you will feel chest tightness, like air is not entering into your lungs properly. And sometimes people will have wheezing sounds from chest. The major symptoms of asthma are cough, shortness of breath, and chest tightness, wheezing sounds from chest, and sleep disturbance in the night time with cough and all. To control asthma, majorly we will prescribe inhalers. By using inhalers strictly, we can completely asthma. Usually in inhalers, majorly two types of inhalers will be there. One will be controller medication and another one will be medication. In controller medication, to reduce the inflammation inside the airways, we will give low dose of corticosteroids, which is very low in dose and safe to use for long time. In reliever medication, usually bronchodilator medication will be there. That is, that will give temporary relief for your asthma symptoms. But controller medication you have to regularly use, even though you are not having any symptoms of asthma. Most of the people, they will use when they are having symptoms, and they will avoid using inhalers when they are not having symptoms. That is not a right way to control asthma. That will lead to exacerbations of asthma. So you have to use inhaler regularly whether you are having symptoms, or if you are not having symptoms also, you need to use inhaler to control. To So you have to meet your doctor and you have to make your asthma control action plan according to that. How many times you are having symptoms in a week, depending on that, doctor will adjust your medication. And inhaler usage technique also very important in controlling asthma. Most of the patients, they won't use inhaler properly. Because of that, we are unable to control asthma. Nearly 60% of the population, those who are using inhalers, they will use directly into mouth. They will take inhaler, they will keep inhaler directly in mouth, and they will press continuously. Because of that, most of the drug will get deposit in their mouth, and this won't enter into their lungs. So that won't be effective. Those who are using inhaler with spacer, they should uh, they should follow proper inhalation technique. It's always better to check your inhalation technique in front of your doctor. While taking inhaler, first you have to shake the inhaler, then you have to connect it to spacer, then you have to exhale completely, and then you should put into your mouth, then you have to press the inhaler, then you have to inhale deeply and you have to hold it for at least 5 seconds, then you have to exhale into the spacer. After using inhaler, every time you should rinse your mouth with normal regular water and you have to spit it out. To control asthma, another major thing is to avoid triggers. Each and every individual, they will have different kind of triggers. Like few people, they will have asthma exacerbation attack with animal fur and all, they will have allergy, so that will trigger. In most of the people, smoking and even passive smoking also can trigger asthma attack. So they should avoid triggers like animals and cigarette smoking, and smoke like while cooking and all, they will expose to smoke. That smoke also, in few people, it will cause act as trigger. And dust in beds and pillows, and dust from sweeping, and strong smells like cleaning detergents and all also can trigger asthma exacerbation. Usually in when seasons variations are there, pollen and all also will trigger. In very few people, even activity like sports and working hard also will trigger asthma exacerbation. But we need not to avoid sports and working. Before going for sports and all, we have to use inhaler at least 10 to 15 minutes before, so that we can avoid exacerbation of asthma. Particularly strong smells and pets we need to avoid. And those who are having asthma, it's always better to consider some changes in their bedroom arrangements. So they should avoid rugs and carpets. That will be better, because on rugs and carpets, mostly molds and all will grow. That possibility will be there. So it's better to avoid. And do not let animals on the bed in your bedroom. That animal fur will cause act as irritant, and it will cause exacerbation of asthma. And no smoking and strong smells also you should avoid in your bedrooms. And dust and all will collect in your mattresses and blankets and pillows. So you should keep it clean always, and you should take proper precautions to avoid that. To like dust proofing covers and zippers on mattresses, those things you can use to avoid this dust exposure. And do not use those mattresses and pillows having straw. Wash sheets and blankets very often, live in hot water. That these precautions will reduce the exacerbations from bedroom dust and all. So these precautions we should follow. And regular physical activity is very beneficial for asthma patients. Running, sports, and working hard they can do, but prior to that, they should better to use medication, controller medication, at least 10 to 15 minutes before they should use controller medication. Okay, and it is very important to be in touch with doctor asthma control, follow asthma control plan. And even though if you are not having any symptoms, it's always better to meet your doctor at least for 6 months, once in a 6 months, and you have to plan accordingly. And to measure your asthma is under control or not, usually we will suggest you to use peak flow meter. In that, you have to calibrate your expiratory capacity. It helps doctor to decide is some trigger is there or not, is asthma is going to exacerbate or not. If your lung capacity is coming down means sometimes before symptoms develops, we can predict with peak expiratory flow meter. So it's always better to use that and monitor your asthma. Then- So majorly what we have to remember is we should avoid triggers. Triggers will be different for each and every individual. So we have to find out which is not suiting for us and we have to avoid that. And we should use medication regularly, not like whenever we are having symptoms, or even though if we are not having symptoms also, we should continue medication regularly, and inhalation technique also we should follow properly. These things will make asthma under control. Thank you. 10 minutes.
Yes, good. Yes.